Africa. Welcome to everyone. Sorry, we're starting a bit late. We've had some technical problems. I think Vera is still trying to connect with us. Excuse me. Yes, so Vera is still trying to connect with us. Vera, we can't really hear you. You'll have to put on your speaker, your microphone. So let me just give you some background. So Dr. Vera Songwe is in Addis. I'm in Brussels. I'm connecting with you. I'm teleworking from home. We're all in lockdown, more or less, in different sorts, varying degrees. But we're trying very hard to bring Vera in. Vera is in Addis, where the United Nations Economic Commission for Africa is based. And Vera is also working from home. Now, we thought it would be very important to talk a little bit about what's happening in Africa as regards the COVID-19 emergency as well. You may have seen rather conflicting reports. Some people, some media reports and analysts are talking about a calamity in Africa if COVID-19 spreads as the way it has in Europe. But others are saying that Africa is really quite resilient because Africa's had experience with other pandemics, including the Ebola crisis, of course, as well. So there are some conflicting reports. We thought we'd go to Dr. Songwe to get her assessment. Now, Dr. Songwe has worked for the World Bank, for the International Finance Corporation, and you're coming in now, Vera. You can hear me now. You have to unmute, Vera. You'll have to unmute your phone.
Yeah, no, I can hear you now.
Oh, brilliant. And now we can hear you too. This is absolutely wonderful. Sorry about the technical problems, but we are working in very, very difficult circumstances. It's quite a daunting challenge, isn't it? But I'm so happy you're here. So I was just saying, Vera, that you worked at the World Bank and the International Finance Corporation. You've been at the United Nations Economic Commission for Africa now since 2017. You are really one of the most respected economists and policymakers in Africa, widely recognized as such. And we are very, very happy to have you also in our high-level group of African and European personalities that we've set up with the Mo Ibrahim Foundation and the One Campaign. That group is working on ideas to refresh Africa-Europe relations. Now, Africa is finally, after weeks of neglect, finally in the spotlight, and many are a little confused, I was saying earlier, about what really is the situation in Africa at the moment. So we've just seen how difficult it is actually to use technology. Sometimes it works, and it's miraculous, and sometimes there are hitches. But I want to ask you, what is the situation? What's your view on what's happening as regards the COVID-19 emergency in Africa, Vera? Please.
Thank you. First of all, thanks very much, Shada. Thanks for inviting me to the program. It's a pleasure to see you again. I think, yes, there is a lot of physical distance, but hopefully that there's more social connections, and that's one of the things that we're doing across the world. Africa is sort of, preparing, let's say, for the next wave, or to become the next wave of this crisis, which is now, as we all know, has been declared a global pandemic. I think there is a lot of preparedness, and we're lucky that we're sort of at the tail end of this. What we were expecting, of course, was having the coronavirus hit us and for us to deal with the health crisis. But I think what has happened to us faster, and maybe that's because we're sort of at the tail end of it, is that we're getting the economic crisis much faster. How is the economic crisis translating? It's translating in the fact that all airlines are grounded. So our economy is 51% of Africa's economy was a service economy. We were doing tourism, we were doing logistics, we were doing the financial sector, and all of that has stopped because airlines are not flying, and travel has almost ended everywhere on the continent. So I think while we started preparing for a health crisis, we've now needed to stop and sort of go back and do an economic crisis first and ensure that we can sort of stave that off. Of course, we have 10 of our big economies that are oil exporters, right. And there's been a huge oil shock as well. And so we also have to manage that. Food prices, we are a considerably high food importer. So we're also looking at how can we ensure that there is not a food crisis on the back of the health crisis. So we have a little bit of time and we're working on all that. But at the same time, there's an emergency human and health crisis, and a lot of work is going into ensuring with CDC Africa, with WHO and the African Union, that there is a global coordinated response on the continent.
Absolutely. So as you're saying, the economic impact of what's happening in the rest of the world is hitting Africa. In fact, Vera, you did organize a meeting of African finance ministers just recently. You chaired it, and the finance ministers came out with a plea, an urgent appeal to the global community for debt relief, for quick help, for fiscal, more fiscal space for them to act. Do you think that these ideas, this urgent appeal that came out from the Africans will be heard, is being heard?
Yes, no, I must say that we were very fortunate, because immediately after, we've now held 2 meetings of finance ministers, essentially convened by the Economic Commission for Africa. That is our role, but chaired by 2 finance ministers that are particularly important for the continent. One is the Minister of Finance of Ghana, who is the head of the Development Committee of the World Bank, and the Minister of Finance of South Africa. Of course, South Africa is a G20 member, and South Africa is also a member of the board of the IMF committee. So those were important linkages to be able to bring the global to the regional and take the regional to the global. I think the 2-3 calls that were made were, first, of course, an emergency call for the health response for the global community to support Africa as we respond to this crisis. The second one was the economic call for a fiscal stimulus to ensure that countries can quickly start responding. I think we've all seen the time is of the essence with this virus, and the sooner you can have, first of all, prevention, information, gear, the better it is. But as you do that, and I spoke about the economic crisis, you do need to start ensuring that you can provide food and basic services and safety nets for the most vulnerable. The $100 billion call we called for was a call for a debt standstill. And now over 2 years, initially when we hadn't yet declared this a pandemic, and the IMF had not yet called out a global coordinated synchronized recession, we thought maybe we could do with just interest rates. But now I think we're asking for full debt service standstill for 2 years. We believe that the IMF and the World Bank have all come out and called for some form of debt relief. I think that over the next 10 days, we will be talking about how we move that into a more coordinated and clarified position of a debt standstill. Because I think that the economic magnitude of this crisis is just so big, not only for Africa. We've seen in the United States, 10% stimulus package is being rolled out.
Right. So, do you think, Vera, that the IMF and the World Bank meeting that's going to take place on April 17th will come up with a response, a coordinated response that will satisfy Africa? Do you think that's going to happen? Are you optimistic about that?
We cannot only, we must be optimistic, and we're working very hard with the World Bank, with the IMF, with the European Union. The European Union today just announced $15 billion of some kind of support. So I think that that's already a beginning of a good momentum as we build up towards the World Bank and IMF meetings. So we are optimistic, and we are grateful because they're reaching out. There's a lot of conversations going on between Africa and the World Bank and the IMF. So we're hoping, we're cautiously optimistic is the word.
Right. So we talked a little bit about the global supply chains and the tourism industry and how trade is being disrupted. Now, Africa was on the verge, or has actually already agreed to set up this African free trade continental area, removing borders across the 54 countries. And I was wondering, what do you think is going to happen, Vera? Is that going to be jeopardized by the current crisis? And how is it impacting on the trade front? Countries are retrenching, countries are building, export controls are coming in, import controls are coming in. How do you see this happening in the trade front?
We're seeing 2 things, and thank you for that question. Yes, we were priding ourselves on the continent for a very long time with the fact that we had passed the CFTA. We were moving towards more multilateralism, towards a much more coordinated approach to trade. Of course, we had to finalize.
Sorry, we're having trouble with Vera's iPhone. Vera, are you able to come back in? So we can see that this is really going to be a complicated technical conversation, but I'm still hoping that you'll be able to come and explain to us, Vera, all the different issues. One of the things, of course, that we've talked about is that we need short-term recovery measures from the World Bank, coordinated, but also we have to think about the long term. And in Africa's case as well, Yeah, I was just saying that in Africa's case as well, we have to think about the trade aspects, the short-term aspects, but also the longer-term aspects. So explain to me about the
Can you hear me?
Yes, absolutely. You were telling us about the African Continental Free Trade Area and those ambitions. Do you think that those are going to be at risk now?
They will not be at risk over the long term, but they will be at risk over the short term because, of course, because of the social distancing, we cannot meet to discuss and finalize this. These are intensive trade negotiations which need people to meet. And so because people cannot meet, it's very difficult for us to continue those negotiations. So we believe there will be a little bit delayed. But I think what is happening and what we're seeing is that, you know, particularly as we're looking for more personal protective equipment, the PPEs that are needed for the health sector, a lot of African countries are launching production chains that will begin to supply the continent. So in a very roundabout fashion, I think intra-Africa trade, which was the objective of the AFCFTA, the African Continental Free Trade Area Agreement, is going to begin to happen. We're already beginning to talk about agricultural commodities and whether countries that are just about to get into their planting seasons can start planting more so that other countries can demand it later. So I think what we will see at the end of this crisis is actually increased intracontinental trade and maybe a fast tracking of some of the policies that have been needed, sort of removing tariff on goods, sort of pharmaceuticals and agricultural goods for intra-Africa trade to flourish. So I think that may be one of the positives of this crisis is that we realize the need for more intra-Africa trade and we do it better and faster.
Well, that's a very interesting fallout and a knock-on effect of the crisis, actually bringing countries together in an effort of solidarity. I think that's a very important point to make. Vera, I was also wondering about the informal sector, because I mean, in Africa, as in many developing countries, it's the informal sector that is such a backbone of the economies. And, you know, we're talking about vendors, daily wage earners, etc. If as we see here, many countries in Africa are in some form of lockdown, how is that impacting on the poorest of the poor in a sense?
Thank you for that question. That's quite an important question. We have run some numbers that show that, you know, the elasticities of a dip in growth, particularly for the informal sector, are about 48%. In the service sector, for example, I just talked about, we have about 62 million direct jobs. Behind each of those direct jobs, there's anywhere from 5 to 10 people that are working in the informal sector. And I think one of the biggest consequences of this crisis, if we are not able to get some stimulus and some relief, is that, you know, we know where the poorest of the poor are because we have in many African countries since the 2008 crisis, we've made an effort to create safety nets for them. But we do not know where the informal sector members of our societies in many of the countries are. And those are the ones that are going to be the most hit by this crisis. So there's a lot of work with the technology companies to see how we can reach them, how we can identify them, and how we can come quickly to their aid. I think it's important that we do that quickly, because if we want to be able to fight this virus, we need to continue to maintain social distance and stay home. And if these people stay home, they lose their income. So some way of providing them with the basic needs, that the food needs, health needs that they will require is particularly important. So a lot of work across the continent is going towards looking for this particular informal sector that has now become quite vulnerable.
Vulnerable, but also a lot of women work in that sector. So there's also a gender element to the informal sector and the need for quick relief, right?
Exactly. The women are in the tourism sector, women are in the hoteling business. And so indeed, a lot of women that will be affected. But it's interesting because there's also a lot of women in the healthcare sector. So when we talk about the women, and this is, I think, why we continue to talk about the need for gender equality, women are on the front lines of this crisis and they are in the back end of the crisis. And so we do need to find ways of both supporting those at the front line, our healthcare workers, but making sure that those in the back end also receive the appropriate support that they need.
So let's go back to the health sector as well, Vera. And you've talked, I've read some of the articles you've written, and you've said that corruption and poor governance, especially in the health sector, are a form of cancer in Africa, a form of cancer in many developing countries. In fact, let's be very frank about that. Just explain a little bit about what governance means in this health sector that is now so fragilized and so vulnerable to pandemics.
I mean, I think an easy one, and one that we will all recognize very quickly, is counterfeit drugs. There's a huge system of counterfeit drugs on the continent, talking about women. When you look at, you know, mortality rates in maternal and child care, quite high. because a lot of the drugs that are used, oxytocin, for example, 60% in some countries are counterfeit because we don't have the right regulatory systems, or maybe, you know, we approve vendors that we should not be approving. We maybe procure from the wrong places. And I think that some of these things we need to globally, continentally work towards creating. And that's why the African Medical Association, which has just been recently created by the African Union, and the Center for Disease Control here are very important regulatory bodies that we need to work with to ensure that we can get the right kinds of medicines. Because what is terrible about this, and this is what is terrible about corruption, is that those who cannot afford the right drugs are the ones who buy the counterfeit drugs. So they spend the little money they have buying the wrong thing.
Right. So Vera, just to come back to the European Union, and it's true that yesterday there was this announcement of 15 billion euros in emergency assistance for Africa. Where do you think that money should be going? What's your wish list? If you did have an opportunity to put it to the European Union, what would you say? Where should this money be going?
Look, I think without any doubt, the first part is for the emergency healthcare response. We need the PPEs. We are not testing enough. We need to test more. We need some ventilators. So I think that first, line of defense must be taken care of: information, PPEs, test kits, and ventilators. The second line of defense, of course, then becomes the economic line, where people have lost jobs, and we need quick emergency safety nets to ensure that we can get them. We can also, by producing the PPEs and some of the test kits on the continent, we've seen in Senegal and other countries that there is some work going on. A couple of factories are being repurposed in South Africa, in Ethiopia, where I am. So that can also create jobs. So I think that there is that combination, that those resources should go to that first line, help create some jobs on the continent as we produce some of the material for ourselves. And then, of course, the safety nets response.
Some of the questions that are coming in to us talk about also perhaps having, let me just read it to you, partnership between Africa and Europe on science and research, especially on pandemics. What do you think of that idea?
Exactly. No, it's part of the response that we are calling for. It's more of the medium to long-term response. I mean, we've just seen with this laboratory in Senegal being able to, develop new test kits. I think Senegal is a key center for research. South Africa is another one. We need to do more. I think because of climate change, we have the low-cost infections. We're going to begin to see a lot more of this health, hopefully not pandemics, but outbreaks. And we hope that we can have more research centers on the continent, in collaboration with others, by the way, that can ensure that we are on the front lines and in time come to this to solve the problem. There is also the need for vaccines. We need to be able to produce vaccines on the continent and do that quickly. So there's a lot of research that will need to go into that, and we hope that as a continent we can strengthen our capacities for that.
So another question that I'm getting now, Vera, is that the question says, in Europe, it looks like countries that have had full-scale anti-tuberculosis vaccinations, and that they mean that there is more of a immunity built up towards pandemics and towards the COVID-19. Have you any idea if that's the case in Africa as well, that these vaccinations are helping people to be more immune to COVID-19?
Look, we are at 10,000 cases on the continent today. I don't think that that's a big enough sample to be able to make that kind of determination. So I think in Europe, the sample size is quite large. And so one can say something like that. On the continent, I don't think that there has been any research that has been done or any analysis to make those kinds of declarations.
Okay, and just looking ahead, I mean, we're talking about an emergency now, of course, and it is a worldwide emergency, as we know. But I think we spoke a little bit about this yesterday. A lot of governments are now sort of looking inwards and doing something on national levels. And we talk about international solidarity and cooperation, but actually, so far we haven't really seen this. Let's hope that the IMF and the World Bank, and of course this aid package from the EU, will change that dynamic. But is it important to start thinking now of what happens once this dark period is over?
Precisely. I think the Secretary General talks about building back better. It's not just building back our economies, but it's building back our partnerships. I think it's important for us to also acknowledge that when the pandemic hit, it hit most of us by surprise. I think when Italy was the first country in Europe to shut down, everybody was shocked. So there was a moment there of just a total consternation before we understood what was happening. But I think as many more countries get the virus and sort of get hit, we are understanding that there is a need for global coordination. I think there was a WTO, a World Trade Organization meeting recently that is talking about us opening our borders and us sharing. Again, as I always say, the importance is that if one person has the virus, the world has the virus, because its sort of contamination rate is so high and so fast. So we must come together to ensure that we totally eradicate it globally from a global community. And we need leadership to do that. Both regionally, and the African Union and the heads of states have been meeting to talk about that. The G7 has met, the G20 has met. So we hope that we begin to see, and now the IMF and the World Bank. So I think those circles of collaboration and multilateral conversations are beginning to happen much faster and in a much deeper way. And hopefully that at the end of this crisis, we can learn and build from that.
Thank you very much, Dr. Songwe. I know that you're a very busy lady and you are in great demand and you have a lot to organize and coordinate at the moment at the level of the African Union and Africa, generally the African countries. If I could just ask you a final question coming from one of our viewers, it's really about your hope for the future. Now, you've said that there are these meetings coming up and you hope that there will be international coordination, Africa's working together, even perhaps the African free trade area may be accelerated because of what's happening. We all one hope for the future. What would it be?
That, you know, the huge innovations on the continent help us to ensure that a lot of the people today that are out, without a job can find a job when we meet on the other side of this crisis, and that we're able, I think, hopefully on the continent to contain it, and that we don't see the numbers that we're seeing in other parts of the world, and that hopefully even in the other parts of the world, they can contain it much faster.
Thank you very much indeed, Vera Songwe, for joining us for this strategic conversation. I'm sorry you had such difficulty in the beginning, but you did say that technology is working in favor of bringing Africa also into a faster growth pace and a growth dynamic. So we're hopeful that this will change as well, and that we'll see you again as well. Just to say a few words about what's going to be happening at Friends of Europe, we have a conversation tomorrow with Mario Monti and Pascal Lamy on corona bonds and debt, etc. So that's, of course, a very important issue for the European Union at the moment, showing lack of or proof of solidarity. Let's see what happens in the medium term. For the moment, it's looking rather grim, we have to say. In Africa, of course, Vera, you've said it, there is a growing recognition now in Europe, in the West, and in developing countries that we have to look at the long term, even as we look at the short term and deal with this emergency. And there's a need for international solidarity as well. Just a final word to say that we at Friends of Europe are online with our publications and with our online events as well. So please join us again. And finally, of course, we at Friends of Europe are also working very hard in expanding our own information analysis and research on Africa through the high-level group, but also through new task force alliances. And of course, every year, and Vera, you know that, we also have an Africa Summit, which this year will be held, of course, again in autumn. So once again, thank you everyone for joining us. Vera, thank you very much for joining us. You're a very busy lady at the moment, and we really appreciate the time and the effort you put into joining us so very quickly. Thank you again. Stay safe, everyone, and stay healthy. Bye.
Thank you, Friends of Europe. Thank you for having me. Thank you. Stay safe as well.
Thank you.
Bye.